Hey there. Okay, so for this video, the things that I want to go over is, well, first we're just going to do an incident log. Basically, I want you to know exactly what to do when one of your residents has an incident or a fall, an injury of some sort. You need to make sure that you're comfortable handling a situation like that. And the best way to do that is just to kind of keep going over in your mind the steps you need to take, use common sense, and communicate. As long as you're doing those things, you can't really do anything wrong in those instances. So basically, first things first, when your resident has a fall, obviously, first thing is you're going to, go evaluate them. You're going to see what happened or figure out what happened. Maybe you saw the fall occur, but you're going to go to the resident. You're going to do a skin check. You're going to want to make sure that they don't have an injury or pain anywhere before you attempt to get them up off the floor. In some cases, it's not safe for the staff to get the resident off the floor by themselves. If you have a resident who can't really help, or if you have a resident who's really heavy, then the best thing to do is just to make them comfortable on the floor. Put some pillows around them, give them a blanket, just make them comfortable, and then call me, and then the two of us can get them up together. In some instances, if there's pain, if there's an injury of any kind, or you suspect an injury, then you would just call 911. We would have an ambulance come evaluate the person and determine if they need to be seen. Basically, if we're going to go over the scenario, if we don't think that there is a major injury, nothing severe, they're not having pain when they move their leg or their arm, then we're gonna move forward with assisting them up from the floor. Like I said, this is a situation if you feel safe and comfortable getting them up by yourselves, the resident is able to help you with getting them up. Like I said, if you feel like you cannot get them up without possibly risking hurting yourself, you would call me. So, moving forward, you get the resident up off the floor, you perform a skin check, and you're like, okay, this person has no injuries found. Let's say that you saw them slide off the bed, okay? I know it's happened before with a resident who maybe is trying to pick something up off the floor from their bed, maybe grab their shoes or something like that. Sometimes they're reaching down and then they just kind of start to slide off the bed and can't stop themselves. Usually in a situation like that, they don't hit the floor too hard and you don't usually see injury. So let's say that happened, you see it happen, you check your resident, you see that they don't have any injuries, they're not having any pain, they tell you they're fine. You're able to get them back up onto the bed with their help. Now you're going to fill out an incident report. Okay, let's say it's at 11 o'clock at night. So you're going to fill out one of these, which is the incident log. This is a document that's required by the state. You just put the date. You just want to put the resident, what happened, and you want to make sure that you write down who you reported it to and what the outcome of the incident was. Okay, now for those steps, you always want to report to me any type of injury or accident that happens in the home. Once you've reported to me, typically I'll either direct you to notify the family, or I'll let you know I'm going to notify the family. Or, like we just talked about, if it's 11 o'clock at night, there's no injury, there's no reason to be concerned, then we would just pass that. We would delegate that to the day shift who comes in the next morning. We'll have them give the family a call in the morning and report, the incident. And that gives us the opportunity too in the morning to do another skin check just to make sure a bruise or a mark didn't appear, you know, after the incident occurred. So we can do a skin check for the second time, and that way we can give more accurate information to the family if the resident did end up with some bruising or a scrape or a scratch. So anyway, so you'll fill this part out on the log. You just fill out the one line across. There's always an ongoing log in this binder, which is the incident log and DSHS hotline reporting book. So it's a hot pink one. That's the one for all of the injury and incidents. So after you fill out this log, you're going to fill out a detailed injury report. This is where you're going to write down, you know, obviously the resident, where the fall occurred, how the fall occurred if you saw it. If you did not witness the fall, it's really important that you don't assume, okay? Even if it's just completely obvious what happened, you want to make sure that you only write what you saw, what you heard, with your own eyes and your own ears. You do not want to write an assumption. You can state what the resident said. Also, you can say, you know, I asked the resident what happened, and the resident said that they slid out of the bed. You know, something like that is okay, but you don't want to put they fell out the bed or they slid out the bed if you didn't actually see them slide out the bed. So anyways, then you're going to write down on here who you reported the incident to. Typically, we always want to report to me, to the family, and to the doctor. Even if there's no injury, even if there's no mark or bruise, it's good to make sure that the doctor's in the loop. That way, if the doctor wants us to follow some sort of instruction, maybe he wants us to start doing some sort of monitoring. Maybe he wants to have, you know, blood pressures for a week, or, you know, something like that. We want to make sure that we report to the doctor so that if he has concerns or instructions, we can follow those. Also, it takes any like legal medical responsibility off of us, and it gives it to someone who is it gives it to someone else who is more has more training and experience with medical. So we don't want to ever just kind of keep that ball. You got to look at it like any information with a resident's medical, any type of pain issues, symptoms that they're having, falls or injuries that have occurred. You want to look at that information as a ball or a hot potato. Okay, you do not want to be holding that hot potato if the family or the state or something happens to the resident and they're like, why didn't you report it to the doctor? Or why didn't you tell so-and-so? Why didn't this happen? You don't want to be the one holding the information and not passing it. So you toss that hot potato right over to the doctor, okay? And then the doctor can determine what happens. That's as far as our responsibility goes. As long as we're reporting it, then we're doing our job and we don't have any legal ramifications from doing that. So make sure you pass that hot potato. Hot potato to the doctor, hot potato to the family, and then everybody's in the loop. If there's action anyone wants us to take, they need to tell us at that time. That way, and if they don't, then they can't come back and say, oh, well, you never told me. I would have had this done, or I would have wanted her to have that done. They can't say that because we did tell them, and then we're covering our own butts. So anyways, you're going to fill out this detailed report. You're going to then make a copy of this report, okay? Make a copy in the copier so that you have, you know, 2 reports, and then you're going to put one in this book, always. Always put a detailed report in this incident log book. The second one that you fill out is going to go in the resident's progress notes, okay? So let me grab a book. Okay, so I have a resident binder here. Since these are on videos, I don't want to compromise anybody's privacy or confidentiality, so I'm not going to actually show names or anything. But what you're going to do is you're going to go into the binder, resident binder. You're going to go to the tab that says Prog Notes. You're going to turn to that tab under Prog Notes, and then you're just going to put your detailed report right on the top. That way everything's from most recent to, to further away in the past. So, we want it to go, we want the most recent documents in the front. So that would get filed in the front, and then of course, after you get your copy in the resident binder and your copy in the incident log, then you're going to make sure that you document it in the COM book, okay? Now, you're going to notice that throughout these videos that I have people doing a lot of different reporting. Reporting to me, reporting in the COM book for the coworkers, reporting in the log for the state, and then reporting in the binder for the families and for our records. If we need to go back and check something, we have it right there in their Prog Notes, so it's easy to find. Now, reporting it in the COM book for the staff, you don't have to put a lot of information. You don't have to put everything that happened. You can just put, Susie had fall, 0 injury, C report, or C injury log, anything like that. Just keep it real simple. Also, when you're writing in the COM book, try to say things in the most simple, direct form as possible. You just want to put, instead of, well, I went to the room and found Susie on the floor, and Susie said that she slid off the bed. I did a skin check on Susie. Susie's okay. Couldn't find any marks, or Susie had a bruise on her left elbow. Helped Susie back into bed and reported to Corey, and da-da. Rather than do all that, just keep it simple. Just Susie, non-injury fall, C log, C incident log. And that way it's just short to the point, and people aren't having to read a whole bunch of stuff. If they want to get the details of it, they can look at your detail report. Anyway, so make sure that you communicate that, because the reason why communication is so important is because if that happened on my shift, right, and then I didn't report it to the next shift, or I didn't put it in my notes for the next shift, and then you have the family show up and they find a bruise on Susie when they're visiting with her. They see a bruise on her arm, and they're like asking the staff, oh, how did that bruise happen? And the staff's like, oh, I don't know. We don't want to look incompetent. We don't want to be ill-informed, because it can affect the way we're able to provide care, and it can affect people's perception of us. If we don't look, if we're not organized, if we're not informed, if we're not letting each other know about things like that happen, we're going to, we're going to look incompetent. So we want to make sure that we are communicating everything to each other. You don't want to let anything slip through the cracks. Now, the other reason is, say I didn't report it to Susie, or say I didn't report Susie's fall to the next shift. Now, the next shift isn't going to know that they need to fax the doctor the incident report, and they're not going to know to call the family, because they don't even know the fall happened. So you see the importance of making sure everybody's in the loop. Now, and the reason why you report to me is because if you leave notes for next shift saying, oh, Susie had a fall, please fax doctor and notify family, if I know about it, then I can make sure to follow up in a few hours and be like, hey, did you read night shift's report? Did you get that fax to the doctor? Did you call the family? I can follow up to make sure things don't slip through the cracks. So that's why it's important for me to know what's going on too. Not to mention if there's, you know, more serious injury, if someone got a skin tear or a scrape, we may need to apply first aid treatment to that. And we may need to make sure that the next shift is changing the bandages and providing that care too. You don't want them to just be helping the resident in the bathroom or helping the resident change their clothes and then they find a bandage on someone and have no idea how it happened. You see what I'm saying about how it's so important to communicate. So the communication book is like pretty much your life. So when you come in, this is going to be really important that you're checking up on this. You're reading the previous day's reports from when you were gone, not just the shift before, but if you haven't been in for 3 days, you need to go over all of the reports from the last 3 days to make sure there's nothing you should be aware of, to make sure that there's not something that you need to follow up with, or to make sure that there's not a change in someone's care or medications that you don't know about. So make sure the comm book and then the calendar on the wall, you're going to want to make sure you're always checking that, because that's going to tell you if you have someone who has appointments, if you have someone who's coming to visit someone, a doctor's coming or a nurse is coming or a therapist is coming. You know, it keeps you in the loop on everything you need to be on top of. So calendar and comm book are super important to be on top of those. Okay, and make sure that you're leaving your information in these places. If we get a phone call and the doctor says, oh, I'm going to be in tomorrow at noon, you need to make sure you're writing that down while he's telling you on the calendar so that the next shift knows to have the resident ready for the doctor's appointment, that sort of stuff. So make sure that you're on top of the comm book and the calendar. Now, the other super important book that documenting takes place in, besides the incident log, is the MARS, okay? Now, this is all related to medications, okay? So this one is super important. This communication book is everything. You're going to be communicating if someone needs to look at the MAR for med changes. You're going to be communicating if someone needs to look in the incident report. You're going to be communicating if someone needs to look in one of the resident binders for, you know, an updated care plan, for a new assessment that was done, for something in the prog notes, or you know, to update family members' phone numbers, you know, anything like that. So the comm book is the center of everything. And then the next important book is the MAR, and that's the one that revolves around medication, around vitals, bowel movements, pretty much anything that has to do with ordering inventory, ordering supplies, medication supplies, refills, all that kind of stuff is going to be in this book. So these two are the ones that you will have out for your entire shift, because you're going to be reporting in here, you're going to be signing off on here every time you give a med, if someone has a bowel movement, all those kinds of things. When you do vitals, you chart it all in that book. So these are like your core right here. So that's pretty much it for injury and incident. If you do have a resident who gets hurt when they have a fall or an incident, you need to, if it's something you can treat, then you need to treat it, like a cut, you know, that you could put some Neosporin and a Band-Aid on, or you know, some gauze over. You will want to, you know, document their vitals after they've had a fall or an injury, and you're going to want to make sure that you, if we need to call an ambulance, that you have all of the paperwork ready for the ambulance people. You're going to need to have the copy of their POLST form. Okay, this green sheet here, it's in the front. It's in the front of every residence binder, so you'll see it just right in the front pocket. Do not give them this one. Oh my gosh, you guys, do not give them this one. They will lose it, and then we'll have to get a whole new one filled out. You make them a copy of this, okay, on the copy machine. Do not give them the original. Then you're also going to make a copy of the MAR. You're just going to pull out their vitals sheet, which looks like this. Okay, you're going to pull out their vital sheet. You're going to make a copy of that. You're going to pull out their BM log, and you're going to make a copy of that. You're going to pull out their MARS, okay, the stack. You're going to make a copy of that. Then you're going to throw our originals right back in the slot, okay, and then you're going to have it ready for them. The other thing that you want to make a copy of, so that's everything that's in the MARS, the MAR, the BM, and the vitals sheet, okay? Then you're gonna, the binder that you get, the green pulsed form, and you're gonna make a copy of the resident's ID sheet, because that has their insurance info, you can make a copy of their identification and insurance cards too. So you want to have all that ready, so when they get to the hospital, they know who they have, they know what their needs are, what their medications are, they know the last time they had a medication, they know their allergies, they have everything they need. So you got to make sure you make copies of all of that. Post form, ID sheet, insurance cards, MARS, BM chart, and vitals. Okay, you're just going to throw all that in, make copies, and then you're going to give it to the ambulance guy. If it's an immediate emergency, then you're going to call 911, and then you're going to call me, okay? I call it the 3 B's, okay? I think it's the 3 B's. It's blood. If a resident's bleeding out, or a lot of blood, if there's a lot of, I'm not talking about a little cut, but I'm talking about if there's a lot of blood, you need to call the ambulance, okay? You call 911. If you think a bone is broken, that's the second B, blood, bone. If you suspect that they could have a fracture or a broken bone, you need to call the ambulance. Do not get them up, do not move them, okay? The ambulance people will do that. So blood, broken bone, and what's the third B? Shoot, I don't remember. Not bruise. Bruises are okay. If you think that they have any type of a head injury, then that would be a reason why we would call 911. If they hit their head good on something, then we'll call 911, especially if you see any type of mark. You know, if they got a cut, they might need stitches, they could have a concussion. There's lots of things that could happen with a head injury. So we want to have a head injury looked at right away. We'll call 911 for a head injury. Anyways, so pretty much that's everything. If I can remember what I referred to the third B, I'll let you guys know. But anyways, that pretty much covers everything. I'll come down if you're not sure, okay? If you're not sure if you should call 911, like you're like, I don't know, it seems like maybe I should, but am I overreacting? Then call me, let me know what happened. I'll come down and we'll assess the situation together and determine if we need to call the ambulance. Sometimes I may even call the family and let them decide. I'll, tell them, okay, this happened, we're not sure about this. We can either call an ambulance tonight and have them take them in, or you can take them to the doctor tomorrow. Which one would you prefer? Because sometimes they would rather take them to their regular doctor then take them to the ER if it's something that's not life-threatening. So we give them, you know, the choice for which way they want to handle it. But if they can't take them to the doctor, if they're like, there's no way I can get my mom to the doctor tomorrow, then we'll be like, okay, we'll just call the ambulance so that we can make sure. It's better to be safe than sorry, you guys. It's always better to be safe than sorry. Even though the residents or the families may not really like dealing with the hospital and the long waits in the ER and stuff, it really comes down to, we don't want to risk their health. So it's better to send them and have everything turn out okay than to not send them and then have things go really wrong. So just make sure that you're erring on the side of caution when it comes to those things, because, you know, it's someone else's life, it's someone else's health in your hands, and we don't want to make, you know, poor or risky choices with that. Anyways, so that's pretty much everything. If you guys have any questions, let me know. Or if there's any information that I left out, or you know, that you still have questions about, then yeah, let me know, and we'll get it straightened out. All right, well, I hope you enjoyed the video, and you guys have a great day. Bye.